I am Kimberly Bonati alongside Ethan Euchre.
Glad to be here.
Yes, Jeff Wagstaff.
Hello, everyone.
And world-renowned orthopedic surgeon, Dr. Alfred Bonati.
Hi.
What's going on?
Well, we need to really think seriously on the healthcare for the nation and not Medicare for all. The problem is Medicare for all that they are proposed by the Democrats is 32 trillion. We don't make 32 trillion income in the whole nation. The government doesn't do that. So imagine how out of touch these people are. I saw socialism in medicine before in other countries, and the doctors, they have no contact with the patients. They are being a number like doctor number 20 for Mr. Jones. And Mr. Jones never see the same doctor again. So it's no continuation of care, it's no knowledge of the physician, of the patient. And the next thing that happens, the amount of healthcare expend is enormous with the tremendous bad results. The patient needs to be loving his doctor, the doctor needs to be loving his patient. Otherwise, it's no relationship there.
And that's been on the decline for a long time, hasn't it, Doc?
because every time is getting more socialistic behavior with the insurance in the middle.
Mm-hmm.
Now, they need to be, this relationship is very important, but you need to understand the concept of the insurance related to the healthcare. The insurance is really something that the employer will pay for the insured, for the employee. So when the employer contract an insurance, it's communication between the insurance company and the employer. And then they decide to do very little for as cheap as possible that insurance for the company, and the service leaves the patient in a deficit situation. So there are some patients that they have an insurance, but when they go to a doctor, they need to have a deductible of $20,000, and nobody can pay that. So the situation is go to the Health Freedom account. And the Health Freedom account is very interesting. First, maintain the patient and doctor relationship intact. Second, the money that the employer is putting, instead to put on the insurance company, they give to a saving account of the employee. So the 70% that I pay for my people, and instead to go to the insurance company, should go to the account specific of my employee. The important thing with this, that the patients not only will control their money, but also will control the deposits that they can do.
Well, I've always said that all the money I've spent on health insurance, luckily through the last 20 years of being in the workforce, knock on wood, I haven't really had to use it very often. But if you add up all of that,
it's crazy.
It's a crazy amount of money that I'd never even tapped into that resource to use. So
you're paying the premium without receiving any of the benefit.
Care at all, right?
Mm-hmm.
Yeah.
And I think those premiums only were raised under Obamacare, if I'm correct. I don't remember people having $15,000 to $20,000 out-of-pocket expenses ever before Obamacare was implemented.
Yep.
Well, that wraps up American Medicine Today. Make sure you check us out again next week.